Radiation therapy is one of the most common treatments in cancer care, and yet still fairly misunderstood. People hear the word radiation and often think of something dangerous or mysterious, something that damages the body. Yet in cancer care, radiation is used with incredible precision to target cancer cells while trying to protect the surrounding healthy tissue. So what exactly is radiation therapy? How is it different from chemotherapy? Why is it considered local targeted treatment? And why can it still cause side effects? And what is actually happening inside your body during radiation? In this episode, we are going to break down radiation therapy into plain language so you can understand what is happening and why it feels the way it does. Let's talk about it. This is the After Cancer Podcast. I'm your host, oncology physical therapist, Dr. Leslie Waltke. For more than 3 decades, I've walked alongside people living with and beyond cancer. Whether you are a survivor, a caregiver, or part of a clinical team who cares for them, I'm glad you're here. Because life after a cancer diagnosis can feel uncharted and confusing, even when you have a great medical team. In this podcast, evidence, empathy, and the real human experience come together to help you navigate the physical, emotional, and practical realities of cancer and the life that comes after. This is the After Cancer Podcast, rooted in medicine, spoken in human. Hello, After Cancer community. This podcast is brought to you in partnership with Cure. Welcome back and welcome to episode 12, Radiation Therapy 101. This is the final episode of our 4-part Cancer 101 series, where we've been building step by step from understanding cancer at a cellular level to surgery, to chemotherapy, and now to radiation therapy. Radiation therapy is often described as targeted treatment, and that is true. But targeted does not mean small, and it does not mean insignificant. Radiation is powerful, it is precise, and it can have real effects on the body during and after treatment. Many patients receive thoughtful education before starting radiation. But when you are processing so much at once, it can still be hard to fully understand what's happening inside your body. That gap in clarity can make the experience feel more difficult. Today, we're going to walk through what radiation therapy is, how it works, and why it affects both cancer cells and healthy tissue, and what it means for your body during treatment and in recovery. Radiation therapy uses high-energy beams, often X-rays or particles, to damage the DNA inside of cancer cells. Remember, cancer cells rely on their ability to divide and multiply. When radiation damages their DNA, it disrupts that process. The cell can no longer divide properly, and over time, it dies. This is the goal of radiation, to stop cancer cells from continuing to grow. Cancer cells are especially sensitive to this because they are constantly trying to divide. So radiation takes advantage of that, targeting cells that are actively growing and disrupting their ability to keep going. Unlike chemotherapy, which travels throughout the body, radiation is localized. It is directed at a specific area. This is why it is often used for tumors that are in a defined location. But even though it is targeted, it still affects the tissues in the area being treated. Radiation is very carefully planned. Before radiation begins, patients go through a simulation process. Imaging is used to map out exactly where the radiation needs to go and not go. The treatment team defines the target area, but also builds in a margin to account for small movements like breathing or slight changes in position. This means the radiation field may be slightly larger than the tumor itself. This is where one of the key misunderstandings come in. People hear targeted and they assume only the tumor is affected. But in reality, nearby healthy tissue is also exposed to some level of radiation, things like the skin and muscle. The goal is always to minimize that exposure, but it cannot be eliminated completely. Side effects from radiation depend heavily on the area being treated. For example, radiation to the breast or chest wall may lead to skin irritation, tightness, or fatigue. Radiation to the head and neck can affect swallowing, taste, and saliva production. Radiation to the pelvis can affect bowel, bladder, or sexual function. These side effects are not random. They are directly related to the tissues that are being exposed. Let's talk about skin changes, because this is one of the most visible effects of radiation. The skin in the treatment area may become red, irritated, dry, or sensitive. Some patients describe it as feeling like a super severe sunburn. Over time, the skin may darken, blister, or even peel. This happens because radiation affects the skin cells that are also constantly renewing themselves. Another common side effect is fatigue. Radiation fatigue most typically builds gradually. It builds over time as treatment continues. Patients may feel relatively normal at the beginning and then notice increasing fatigue as the weeks go on. This fatigue is real. It is not just about energy levels. It is about the body responding to ongoing cellular stress and repair. Patients will often say, I didn't feel any fatigue at first, and then suddenly I did. This is a common experience. Radiation effects can be cumulative. So now let's talk about the deeper tissue effects. Radiation can cause inflammation and changes in the tissues being treated. Over time, this can lead to tightness, stiffness, or fibrosis. Fibrosis is the thickening or scarring of tissue that can reduce flexibility and movement. This is especially important in areas like the chest, shoulder, neck, or pelvis. From a physical therapy perspective, this matters a lot. Patients may notice decreased range of motion, changes in posture, discomfort with movement, or changes in pelvic floor function. Something that is common but not often talked about. These changes can develop gradually and may not be immediately obvious. Another important concept is that radiation effects can be both short-term and long-term. Some side effects, like the typical skin reaction, resolve within weeks after treatment ends. Others, like tissue thickening and fibrosis, can develop even months or years later. This is why long-term follow-up and awareness are important. I also want to talk about something that many patients feel but may not fully understand: the emotional experience of radiation. Unlike chemotherapy, which is often given in cycles, radiation is typically given daily over several to many weeks. This means patients are showing up daily, again and again and again, for treatment. It becomes part of their routine, and that can be both grounding and exhausting. One patient told me, "It felt like my life revolved around that damn machine." Another said, "Yes, it was quick each day, but it was always there. That consistency really wore on me over time." Radiation therapy is also highly technical. Machines are calibrated with incredible precision. And behind that precision is a team of highly trained, thoughtful professionals guiding every step. The treatment team monitors positioning carefully. Even small shifts in position can change where the radiation is delivered. This is why patients are often positioned very specifically with guided alignment. Now let's connect this all to recovery. Just like with chemotherapy and surgery, radiation is not just about what happens during treatment. It is also about how the body responds afterward. The tissues need to heal. Inflammation needs to settle. Movement needs to be restored. This is where physical therapy again plays a critical role. Movement, manual therapy, stretching, and specific exercise can help maintain flexibility, reduce stiffness, and support recovery. Simple, consistent aerobic exercise, like walking during treatment, has strong evidence for helping patients minimize fatigue, maintain energy, function, and overall well-being. And because radiation-related fibrosis and tissue tightness can develop slowly over time, ongoing stretching and mobility work are essential, not just during treatment, but long after it ends. Addressing scar tissue, posture, and strength can make a significant difference in how patients feel long-term. Important point: if you have restricted mobility, tightness, or weakness, even if it has been years after your radiation therapy, this is something that almost always can be improved or eliminated with physical therapy. It's never too late. So here's what I want you to take from this episode. Radiation therapy is powerful, precise, and purposeful. It works by damaging the DNA of cancer cells to stop their growth. It is targeted, but it still may affect nearby healthy tissue. Side effects are tied to the area being treated and can include skin changes, fatigue, and deeper tissue effects like stiffness or fibrosis. And recovery is not just about finishing treatment. It is about helping the body adapt and heal. As we look back and reflect on this episode, Radiation Therapy 101, think about what surprised you most about radiation therapy. Does understanding how it works change how you think about the side effects? If you have experienced radiation, what part of the experience felt hardest to explain? And if you are preparing for radiation, what questions do you still have? If this episode helped you better understand radiation therapy, please share it with other patients, survivors, and caregivers. And let your oncology teams know about the podcast so they too can share it with their patients. Coming up in episode 13, we are going to talk about something that many people are told to avoid, but it actually matters more than ever during and after cancer treatment, and that is exercise, because exercise is life-saving. We'll break down what is safe, what is effective, and how movement can help your body recover, rebuild, and regain strength after cancer. Before we wrap up, a quick shout out to ABCD. After breast cancer diagnosis, ABCD provides virtual personalized emotional support by matching anyone impacted by breast cancer with a trained volunteer mentor who has a similar lived experience. Learn more about getting support or becoming a mentor at abcdbreastcancersupport.org. I'm oncology physical therapist, Dr. Leslie Waltke. Thank you for being here, and thank you for taking this time for yourself. Please exercise like your life depends on it, because it does. And remember, radiation therapy is not just about treating cancer. It's also about how your body responds, adapts, and rebuilds in the weeks, months, and years that follow. So please stay connected to your body and stay connected to your medical and support teams. You are not alone, and you do belong here. Peace out. We'll talk again soon.